Okay, so with the resistance building, where's all this heading? With us now is German politician Martin Dolzer. Also, we have security analyst Charles Shoebridge and NHS consultant Dr Ranjeet. Good evening to you. Thanks for joining us on the programme. Martin, if I could turn to you first, do you understand some of the protesters' frustration that over the past couple of years they've been told to do one thing, then another, then told it's OK, then that it won't be? It's locked down, then it's opened up? Martin, can you hear me? No, I don't think Martin can hear me. I'll speak to Charles then instead. Some of the protests that we've seen over the past week, they've been a little bit agitated, but I think by far the most ferocious has been in the Netherlands with the police opening fire there. Is that an appropriate response?
I think it really depends on the circumstances that police officer found themselves in. For example, I mean, if we are here sitting comfortably in our studios and our kitchens, in my case, it's obviously a completely disproportionate use of force. But having said that, if officers really genuinely did feel that their life was threatened, and again, I wasn't there and we didn't see exactly what the situation was, then opening fire could be justified. It does raise questions as to why officers didn't have less lethal means to combat people that the media and they have deemed rioters. Whether they were rioters or protesters is, again, hard to judge without being there. But I would come back to what you just asked our colleague from Germany, that in respect of what's happening, it's not to, of course, in any way to justify or condone violence on any party or illegal acts or anything like that. But again, it's hardly surprising that I think in the circumstances that are taking place in much of Europe, that there is a great deal of frustration that is being vented in terms of the restrictions that are being placed on people and the requirements, for example, to vaccinate against their will. Now, that we don't need to have a view really on whether those views are justified or not justified. But what I think we can say is that it was absolutely clear, especially after, as you mentioned in your question to our German colleague, that after 2 years, it's absolutely clear, I think, it should have been to policymakers, police chiefs and others involved in security planning, that there would be and will continue to be, I think, a violent backlash from some quarters. This can be seen throughout history, that when you impose restrictions on people and you do it for long enough, there will amongst some people be a violent backlash. That doesn't mean to say that we excuse or condone it, but we have to understand that from some people, I think more and more people are feeling, especially in some parts of Europe, at the end of their tether.
Martin, that fraying trust between politicians and the public, where they're told to do one thing 1 minute and something else the next, do you have some sympathy with the public frustrations?
Yes, if we look at the background, we are in a great world economic crisis since 2008. That even deepened 2020, and that in that crisis there was brought forward measures against Corona which are not consistent in favor of the people, but, for example, in favor of big companies. In Germany, for example, there was a financial help package of 450 billion for big companies, which was mainly saving the stakeholders and shareholders of big companies like Mercedes-Benz or Siemens or BMW and so on, and there was only less financial package, like 50 billion, in favor of small and middle-class companies and in favor of those who are financially underprivileged, and the people see that. And then there is a kind of a lockdown, which again is more hitting the small companies, the restaurants, the small cultural industry, and so on. And it's not hitting the big companies, so that is inconsistent in itself as well. So there is a kind of frustration that those who are underprivileged are even more excluded and are even more underprivileged through the measures which the government did on Corona. Doesn't matter if we look at Germany, Austria, Netherlands or Belgium. It was from the tendency all the same measures done there, in nuances different. But this is a background where the people get frustrated. And so, of course, I can see why the people are protesting. That doesn't mean that I in favor and sympathy of violence, which is done there. I don't agree with that. But you have to see, if you do measures like that, and if you don't bring forward measures like good state-financed health system or measures like vaccines like in China, which are really approved and of a normal way, but you bring a kind of pressure to the people to vaccine with a vaccine BioNTech, there's a problem.
I want to ask Dr. Brar, are there any alternatives to bringing in what feel like now very blunt tools of restrictions and lockdowns, given we all know, not just the medical community, but as society, we know far more about this disease than we did 2 years ago. What are the alternatives to lockdowns and restrictions?
Colin, thanks. I think it's a deeply flawed policy conceptually, and you don't have to be a scientific specialist or a genius logically to see that. We have seen there's been decreasing antibody levels in the blood of people who have been vaccinated, fully vaccinated, within 3 months. So a Nature study was published last month, and that showed that in fact there was only a marginal reduction in transmission, despite the personal protection conferred by vaccination. So a marginal reduction in transmission against the Delta variant from any of the vaccines that they studied, including the Pfizer-BioNTech and including AstraZeneca, which are the two most widely used in Europe and Britain. But 3 months later, in fact, there was no reduction. So while the antibody levels go down within 3 months, it doesn't mean that the personal immunity is lost, but in fact, the rate of transmission is not altered. So then conceptually, the idea that you quarantine or restrict in some way those who haven't been vaccinated versus those who have doesn't have any actual impact on the spread of the vaccine. So it's an unsuccessful measure. And then if you go beyond that and ask yourself whether you would like any treatment imposed on you against your will as an adult, a free-thinking adult in an alleged democracy, we've been told that the protesters are idiots there by the Dutch Prime Minister, and that they are the agents of violence. But the entire concept of medical treatment against your will flouts entirely the free will of the individual and the ability of each individual to decide what is their risk and benefit profile. Let's not forget that the vast majority of people have very low risk from COVID. Of course, the elderly, the frail, we know, suffer from coronavirus. They have a real risk of death and hospitalization. We know that they're well protected by vaccination. And for some of those, booster vaccination may make sense. It's not been proved in the vast majority that those vaccines wouldn't be better spent actually addressing vaccine inequality. So I do think criticism of the demonstrators is misplaced, given these really very draconian restrictions, which are, at any rate, illogical. So
with some of that in mind, to get the thoughts of all of you on this, because when opinion polls are done, it seems that most people agree that COVID measures need to be put in place to try and reduce rates of infection. Then on the same token, people will say that any restrictions, I don't want them to infringe on my constitutional rights. Basically, people seem to think, I'm quite happy with COVID restrictions so long as they don't affect me. Charles, if you were in planning in government, that's almost an impossible position to be in, isn't it?
It's true, but of course what people think is largely guided by the media. And I would comment that in a democracy, one of the main supposedly positive features of a democracy is having access to alternative views and being able to fairly put alternative views. Now, we've just heard a very logical explanation from your doctor guest, explaining why COVID vaccines, and particularly, we didn't get onto the subject of boosters, but of course that will come in Europe as it's now arising in Britain, aren't probably going to have a great effect on transmission, which is what this is about now, or what these restrictions are supposed to be about. Now, those kind of views are completely missing pretty much from the mainstream media. And this adds to the frustration, I think, of people who feel that in a normal democratic society, they would have their voice. But even when they've protested, for example, we've had very large demonstrations in London and elsewhere in the UK that have been wholly ignored by the media. And so I think it leads to a concept within people that they're running out of options as to what they can do. Now, I'm saying this not as, again, we need to be clear, not to encourage that or condone it, but it's understandable that some people are thinking this way, and it's surprising if planners are not thinking that way as well. I think there needs to be. The problem is that we've got a media and government and a select small group of scientists, all of whom seem to have exactly the same message, which if you go on social media, you find not anti-vaxxer conspiracy theorists. I mean, you obviously do find a lot of conspiracy theorists, or whatever that might be, but you also find lots of very well qualified surgeons, people involved in virology and so on who do not subscribe to what is being fed down people's throats constantly, day in, day out, in the mainstream media and from government officials. And as I say, the seemingly very small select band of scientists who are on board that narrative, who get all the airtime.
And Martin, given what Charles was saying there, and forgive me for saying this, but politicians will go with the wind, won't they? Which is why do you think we're getting some countries saying jab or die and others saying there's nothing to see here when all these countries are all facing the same medical enemy?
Yeah, it's not so easy to handle this crisis because, like I said, it's a crisis which is happening in the frame of the economic worldwide crisis. And so the government, in different nuances, somehow misuse the corona measures to compensate or to try to compensate, for example, the economic crisis. If we look at our Chancellor, who was the finance minister before, he knows, he's schooled in economics, so he knew when he wants to bring the German industry forward in that crisis, he has to do measures to strengthen the big companies. And he did it with such a consistency, and the people, they see that that happens. And from that, and in the same moment, there are restrictions which are not really consistent because, like my pre-speaker was contributing, I agree with that completely. That is inconsistent because democratic rights are decreased. Meanwhile, in the same time, in the measures, financial help is more given to those who are anyway privileged or who are just like big companies and who are in an economic crisis. And the people see that, and they won't take that without any counter argument. And it's true, as large other opinions are excluded in the mass media, the more the people will violently try to bring that forward. So that is a dangerous politics.
In the final minute that we've got left, Dr. Breyer, it does feel like science has got an uphill battle trying to get its message across. The more we seem to know about this disease, are politicians hindering that message?
I think they are. I think the economic factor is the overwhelming one. So we're seeing economic inequality with the poorest within societies in Britain, for example, and across Europe, and the poorest nations perhaps most affected by this. And we're seeing least done to actually rectify that fundamental inequality in society. Simultaneously, government are facing record levels of mistrust. We saw a survey published, which essentially showed doctors and nurses were well trusted, but politicians were less trusted than any other member of society. And the record levels of corruption we've seen are a very large factor in people not trusting the message of the government and actually not wanting to take up medical advice when it's offered.
OK, gentlemen, it's been really good to talk to you. I'm sorry we're out of time. I've had to cut you short. Really appreciate your time. Thank you.